everyone to our third leg of our webinar series for Vets in Practice 20th anniversary. So today, this episode was brought to you by Agfield International. So we will be talking about for today's episode, we will be talking about our senior pets. So and I'm very excited to guide you through this, and I know it's very important. It's a very important topic for pet owners because it isn't always talked about, but we will be here to guide you through all the basic care and common diseases for our senior pets. And then I would just like to remind everyone to stay tuned and follow us on our socials on Facebook, Instagram. Yeah, and then at the end of this episode, we will be choosing 5 winners from the comment section to receive a special token from our sponsor. So, thank you everyone, and I hope that this will be a very productive episode for everyone. Thank you so much. So we're back. So I would just like to introduce our first guest for today's webinar episode. So we have here my esteemed colleague, Dr. Camille Macaraeg, to help us understand aging in pets. So Dr. Camille is junior veterinarian at Vets in Practice Mandaluyong. So you can find her at VIP Manda for all your pet needs. And then she will be discussing with us understanding age in pets. Dr. Camille, the floor is yours.
Hello, good evening. I'm Dr. Camille from Vets in Practice Mandaluyong. Hello. So, ayun, didiscuss ko regarding dun sa understanding yung aging in senior dogs. So, senior dogs and cats. So, kung titignan natin, senior dogs and cats, yung kanilang age is ranging from the size. Usually for larger breeds of dogs, mas mabilis silang mag-age than the smaller dogs, smaller to medium-sized dogs. So for larger dogs, senior na by the age of 6 to 7 years old. Pag mga small to medium-sized breeds, sila around 8 to 10 years old. Halos same lang siya in cats. Ganon din yung age nila for senior. Ngayon, tinitingnan natin, ano ba yung mga common signs of aging sa kanila? So, usually for dogs, may kita natin yan sa eyes nila. So, nagkakaroon ng cloudiness on their eyes. And then, malala yung kanilang pagmumuta kasi nga nagle-lessen na yung kanilang teardrop production. So, nakaka-affect sila yun sa vision nila and it causes irritation dun sa eye, yung tendency yun, to the point na magkakaroon ng mga ulceration dun sa mata nila. So, we have example dyan sa naka-flash sa screen. So, ayan, as you can see, dry yung kanyang eyes. So, nagkakaroon ng pagmumuta and irritation dun sa eyes niya and may halo din cloudiness. So, which is common on older breeds of dogs, lalo na yung mga mababalahibo na dogs. So, ayan, may irritation din sa mata, namumula din. And, ayun. So, yan. And then, bukod din sa eyes, nagkakaroon din sila ng problem sa kanilang gums. So, mas nagiging prone sila to periodontal disease, kagaya ng nasa screen. So, as you can see, yan, namamaga yung kanyang gums and meron siyang tartar build-up dun sa may bandang molars niya. So, nagkakaroon ng bleeding. Ayan. And then, may iba, nagkakaroon din ng yung naglalagas yung ngipin, nagkakaroon ng receding gums. Yun. And then, bukod din doon is yung kanilang, meron din for cats. Yan. For the cats, yan. Ganyan yung nakikita natin on some older, or yung mga senior cats. Kakaroon sila ng problem. Naglalagas yung kanilang ngipin. And then, bukod din doon is may kita natin yung balahibo nila, naglalighten yung color. So, from dati na
for
matingkad.
darker dogs to dog. No?
For darker dogs.
For lighter dogs, hindi siya masyadong visible.
Hindi siya halata masyado.
Yes.
So, ayan, example, yung dog ko dati, one-year-old siya dyan sa picture. And then, yung sumunod, na siya, 13, naglighten yung balahibo sa may mata niya.
Aww.
Ayun.
So cute.
Ayun. And then, nagle-lessen din yung kanilang muscle mass around the temple area. So, manonotice nyo din yun for dogs and cats. Ayun, na for senior, which is talaga sa kanila. And then, bukod din doon sa skin, tinutubuan din sila ng mga growth. Yan, may iba nagkakaroon ng mga warts somewhere, and then growth. So, pag ganyan, kailangan silang masilip ng veterinarian to assess kung kailangan ba surgically to remove yan. Kasi, may possibility, siya, malignant. So, kailangan natin masilip. And nagiging prone din sila to dermatitis, mas nagiging sensitive yung kanilang skin. So, ayun. Mamaya i-discuss natin kung ano yung mga proper treatment for that. Yan. And then, bukod din doon, sila din ay nagkakaroon ng problem on the vision. Hearing, yung pandinig nila. So, pwede kasing related to chronic bacterial ear infection, or dahil nga hindi maganda yung kanilang yung hygiene. Yan. So, pag ganyan, kailangan silang masilip ng kanilang veterinarian sa near vets in practice na
Yes, VIP
brand.
veterinarians.
Yeah. Ayan. And then, ayan. Bukod din doon, nagiging prone din sila to gastrointestinal problems. So, mas nagiging sensitive sila to food na binibigay. Pwede kasi secondary to other underlying problem, pwedeng secondary to kidney disease, or may problem sila sa gallbladder or sa pancreas nila. So, hindi na nagiging maganda yung panunaw nila. Aside from that, nagkakaroon din sila ng problem on the mobility. So, nagiging prone sila to bone spurs, bone compression, and nagkakaroon din sila ng degenerative changes on the hips. So, ayan, example, naka-flash sa screen. As you can see, kita yung kanyang bone spurs. So, may naka-protrude dun sa may vertebra niya on the lumbar area. Tapos, incidental findings, meron din siyang urinary bladder stones sa loob. Ayan yung bladder stones niya. And then, ayan, dito, severe yung kanyang bone compression and bone spurs. Ayan, on the lumbar area. And then, bukod din doon, nagkakaroon din sila ng problem sa kanilang mental health. So, nagiging prone sila to cognitive dysfunction syndrome. So, para siyang dementia, yung parang Alzheimer siya in humans. So, yan, as you can see, video ni Jack, dog ni Doc Ali. So, yan siya. Ulitin na lang natin yung video. Siya, based on the video, and yung signs kasi nitong cognitive na dementia, nagkakaroon sila ng disoriented yung aso, hindi sila mapakali on one area, tapos may times na hindi sila nakakakilala ng owner, may mga araw din na nag-howl sila out of nowhere na hindi naman sila in pain. Yung nagkakaroon ng changes sa kanilang behavior. And ito pa isang video.
So for the just to add up, cognitive dysfunction in dogs and cats, it's usually underdiagnosed. So some pets hindi agad nakikita yung signs, or parang yung pet owners, they're not aware that this also happens to their pets. So in just a general guide in caring for your senior pets, they need more checkups, more regular vet visits, so that we can determine the problem as early as we can. So, again, in all our webinars, we always tell you guys this, that prevention is always better than cure. So, for aging pets, it's more important that we prevent these diseases from happening. So, it's really important for us to have regular vet visits. So, visit your favorite vets in practice branch for all your senior pets needs. Okay, so thank you, Doc Camille. So we will be opening the floor for questions. So you may comment down your questions for Doc Camille. Okay, so we have our first question. Okay, we have a 12-year-old and... Is that a question? Sorry, it's not a question, it's just a comment. Hello, Miss Leia Luz Ignacio Victoria. So you can comment on your questions regarding Doc Camille's understanding aging in pets, so that we can answer your questions. Or if you... Yeah, okay. So the first question is from LLL. So what's considered a senior cat or dog? Thank you.
Ayan. So, regarding for senior dogs, it varies from breed. Usually, yun nga, larger breeds, mas mabilis silang mag-age compared to smaller dogs. So, for larger breeds, usually around mga 6 to 7, considered senior na sila. And then, pag smaller to medium size, around 8 to 10 years old. For cats, almost the same as in small to medium sized dogs. Yeah.
Okay. So thank you, Doc Camille, for answering that question. So, okay, next question is cardiomegaly in dogs still reversible? Okay. So I think we will be discussing more about these topics later on I think on the 5th segment. But I think we can answer this, Doc Camille.
Usually, cardiomegaly is irreversible. It's more of management lang. So pag ganyan, kailangan ng regular cardio check-ups, mga heart ultrasound, to monitor lang yung ang function ng sa heart nila, anatomically, kung may kailangan i-change in medications. Ayun. So more of management, and at home din, kailangan lang yung activities niya ay limited lang din. So mamaya i-discuss din further.
Okay. So I think just to be clear, cardiomegaly isn't always a heart disease. So it's just an abnormality in the size of the heart. We need to look into it further for us to know if there's really an abnormality in the chambers of the heart, in the valves of the heart, or in the blood flow. So I think that's a better way for us to diagnose heart disease. And then if there's any need for us to correct this or to support it with medications, that's probably the best way to tackle up these issues. Okay? Okay, so we have time for another question. Okay, so from Seria Monica, how can tracheal and heart enlargement be managed? Because I have a 13-year-old with heart enlargement na sa border daw po.
So for the tracheal and heart enlargement, yung management niya, it's more of having regular check-ups. Usually pag ganito, lalo na pag mga tracheal problem, is monitor natin siya through X-ray. And then nagbibigay din tayo ng mga supplement to support yung sa trachea to avoid yung paglalapan nito. Same with
usually tracheal collapse.
Tracheal collapse. So kumikitid yung labasan ng hangin. Ayun, so more of, kailangan ng supplement, and kung lumala is magbibigay ng proper medications. Doon.
Again, for these issues, it's not, parang hindi siya, it's not a complete formula na same, pare-pareho yung treatment for dogs and cats. So, it's always, parang iba-iba siya based on the case. That's why it's very important that you guys bring your pets in Vets in Practice Capitolio and Vets in Practice Mandaluyong or any other Vets in Practice branches for us to be able to give you a tailor-made medication regimen for your pets, for your aging pets. Okay? So, we still have more time for questions later on, but I think it's time for us to move on for the next segment with Dr. Alison Sevilla. So, I have here Dr. Ali to discuss with us nutrition considerations in our aging pets. Okay, so we are on to our next segment. So I have here Dr. Alison Sevilla. So she is a regular on our webinar series already. So Doc Ali, she is our senior veterinarian at Vets in Practice Mandaluyong. So she will be helping us understand what do we need to feed our senior dogs and senior cats, because it's also important that they get the proper nutrition. So that we can prevent some of the diseases from happening. So, Doc Ali, can get the floor.
Hello.
Hi, Doc Ali.
Hi, I'm Doc Ali. Ayun. Ayan. So, right now, ang i-discuss ko sa inyo is regarding sa nutrition for our senior pets. So, when we say nutrition is usually composed siya nung usual na alam natin is the diet, ano ba natin for our senior pets, at saka ano ba dapat iwasan natin. So, ang i-discuss ko is because ang senior pets natin, iba kasi ang kailangan nila compared sa younger dogs or mature dogs. So, baka narinig nyo na rin ang term mature versus senior. When we say mature dogs, usually ito na yung mga nasa ages na sila ng 5 to 7 years old. And pagka nasabi ng senior dogs is 8 to 10 kadalasan. So, ang ano na lang natin kasi for those types of patients, kadalasan is we have to control din kasi yung fats and proteins, phosphorus and sodium sa mga matatandang aso. Ang ano natin dito is kailan ba tayo mag-change ng diet to senior dogs? For that, I recommend that you consult your veterinarian before switching into a senior diet. So, ang ano ko lang is, Usually, there are types of dog foods in the market na already na if in case you are not able to make or cook food for your dog, there are brands there that are available. So, ang ano ko na lang sa kanya, ay, pwede ba akong magano ng brand na recommend? One of each na we trust is also the Royal Canin. So, they have this indoor dogs na for mature and or senior dogs. So, ang ano natin ko consider natin kasi pagdating din for seniors is if in case meron silang tinatawag na disease, we have to make sure na they are balanced kasi yung kanilang nutrition. So, for example, if your dog has a kidney disease, na-diagnose siya, senior na siya, so hindi normal yung metabolism ng dog nyo. So, kadalasan kapag may kidney disease, I think some of the owners are already familiar na mataas ang creatinine nila, as well as yung phosphorus nila or sodium, baka nagkakaroon ng fluctuation. So, pagdating sa food, kailangan natin i-consider na hindi mataas yung phosphorus, hindi din mataas yung sodium, or masyadong mababa. So, for that, usually your veterinarian will help you regarding doon sa ganong cases. What else? Kadalasan, our senior dogs are actually, they need more hydration. When we say hydration, mas kailangan nila ng water intake. So, kadalasan din kasi ang mga senior dogs, syempre, may iba, frail na, slow-moving. Ang ano natin dyan is dapat accessible yung potable water natin. So, dapat lagi fresh. Tapos, ang ano natin kasi is since yung circulation nila is sometimes very poor, giving them enough water kasi ang ating pwedeng i-provide a good nutrient for your dogs. So, for me, to encourage your dog to drink more water, ano pwede natin bigay? You can offer ice cubes, bone broth, yan yung mga pwede nyong gawin. Pero kailangan nyo pa rin i-consider kasi na wala dapat excess sodium dun sa
No
kanilang...
additives.
No additives. Dapat clear broth lang siya. Ang pwede natin gawin, usually what I do in my dogs kasi, magpapakulo usually ng mga fresh na yung raw bones, kukuloy mga chicken bones or pork bones, beef.
Yeah.
Pagka nakulo na siya, ilagay nyo sa ref, tapos magsusolidify kasi yung mismong fat nun tatanggalin nyo na siya. So, clear broth na yung offer nyo po dun sa dogs nyo. So, that will be your way para ma-increase yung hydration. And then, what else? Since your senior dog kasi hindi sila masyadong gumagalaw, kadalasan, kailangan hindi na ganon kataas yung calories na ibibigay nyo sa kanila. So, for that, kailangan natin i-consider kasi na mas mababa. So, your dog foods na available na in the market can provide you that. Controlled na siya. And do not overfeed your senior dogs kasi hindi na nga sila masyadong nagmo-move. Oo. Unless active pa sila. Oo.
Okay, so I think you can just visit again your vets in practice veterinarians for that because not every senior dog is the same. So it's we can base your pet's nutrition based on their daily activity or their overall health requirement.
Yeah, ayun. So, ano ko na rin, actually sa QC branch namin, nandun po si Doc Denmark. If you are interested for regarding the nutrition of your dogs, he can help you out po. Ayun. So, pero ayun, you can visit our QC branch regarding that. You can call them po. So, what else? So yun lang naman ang usual natin recommended for our senior dogs. Regarding vitamins pala, since doon na rin tayo sa nutrition, there are certain vitamins that your senior dogs usually recommended to have. May mga multivitamins na available for that. Usually, good for omega-3 and 6. Something that is good for the brain, good for the heart, as well as the kidneys and the liver. Yun yung mga supplements na pwede nating offer sa kanila. Ayun. Pero there are some nutrients na hindi na kasi kailangan since hindi na nagagamit. Kailangan din natin maging parang kailangan natin din kasi na observe din natin yung dogs natin pala regarding sa common is the osteoarthritis. So, yung mga joint supplements with glucosamine chondroitin, yan din ay mga something good for your dog. Oo, ayun.
So also nutrition is very important for us to be able to manage the weight of our senior dogs because since they decrease their activities daily, hindi na masyadong tumatakbo, hindi na masyadong tumatalon-talon or nakikipag-play around, they're very docile, hindi na masyado, yun nga, less na yung movements nila. So mas prone sila na nagkakaroon ng obesity.
Yes.
So nutrition is very important for us to prevent those from happening because yun nga, yung mga obese or overweight dogs and cats, mas nagkakaroon sila ng mga diseases that we don't want of course. So nutrition is very important also in preventing yung mga life-threatening conditions. Right?
Yeah. So, yun lang usually yung natin for nutrition. Open na for questions.
Okay. So we have time again for a few questions after Doc Ali's segment. Okay?
Sige.
Okay, this is a question from Mr. Mike Tan. Is it okay to give raw food to senior dogs?
Okay, good question siya actually. May pagka-controversial ang raw feeding for dogs. Kadalasan kasi, yung balanced nutrition kasi yung kailangan natin dyan when we're considering raw food. Especially when handling it din. So, kasi there are bacteria na pwedeng makuha syempre pag raw food. So, for me, giving senior dogs ng raw food, maganda is, I think you have to give it po sparingly for some dogs. Like organ meats or yung mga mismong offals, or mismong meat niya. Pero for personally, hindi ako masyadong fan of raw food. Though there are studies that suggest na meron din siyang benefits. Pero you still have to consider kasi yung balanced nutrition as well as yung food safety ng dogs nyo. Because it can actually cause magkakaroon ng contamination around the household.
And also, like, yung sources, of course, ng raw meats, diba? So, since
okay
it's not always reliable, like, especially from markets or something, so it's not we're not really entirely sure if it's not contaminated by mga worms or something, if exposed sa matagal sa counter, ganun. So, there are a lot of factors that we have to consider. Especially senior dogs, medyo sensitive. Well, as Doc Camille said earlier, they're very sensitive already. So, I think if you want at least to keep if the reason for us to give raw food is to keep the proteins, ganyan, or to keep the nutrients in, ang better siguro is i-blanch ng konti just for the surface to be clear enough or at least clean enough. Pero, yeah, it's the more important thing is it's supposed to be balanced.
Yeah.
So, usually what you get from meat is just a lot of proteins. So, and of course, other nutrients. But there's a lot of things that we have to consider for that to be possible na maging balance yung raw feeding. Right?
Yes. So,
Okay, another question for Doc Ali from Miss Lisa Bringas. My 10-year-old Shih Tzu was given thyroid medication and had an adverse effect. Shaking and catching her breath, we stopped immediately. We would like to have a second opinion.
Okay. Sige. I think more of ato ay matatackle doon sa segment ni Doc Nikki kasi more of siya doon sa kanyang disease. But if in case yung dog nyo po is having this adverse reactions to a certain medication, I suggest that you approach your veterinarian about it. And then, usually, sa veterinary practice, usually we can try to help you out regarding this matter. And then, for me, if in case you have adverse reaction, you can try to stop the meds, pero kailangan immediately you have to be checked by a vet na po agad. Kasi we are known of regarding sa anong merong problema po yung underlying cause ng dog nyo. So,
Yes,
so,
given that
allergies
if it's a hormonal issue, diba? Medyo it's really a bit hard to tackle that. So
Yeah.
medyo mahirap talaga i-balance if it's like kung low thyroid ba or hyperthyroid, ibig sabihin yung mas mataas sa normal thyroid hormones yung results ng dog mo. So I think it's really best that you visit any of our branches for a more well-rounded consultation. Okay.
Thank
So,
you for
we
the
hope to see you
question.
soon, Miss Lisa. Okay, this is from Miss Margarita Infantado Aldecoa. What are natural prebiotics and probiotics that I can give for my senior pets?
Okay. Natural prebiotics and probiotics. Actually, meron na rin kasing available in the markets. You can actually give yogurts, certain yogurts pwedeng ibigay sa kanila, or yung meron na tayong available kasi in capsule forms talaga, specifically for your dogs. So, like Promax. So, that's a type of probiotic that is good for 3 days. Actually, ang maganda rin sa kanya is especially for dogs with inflammatory bowel disease. I highly actually prescribe this. So, eto siya in front. Here. Ayan. Ayan. So, they're really good. It's a good product po regarding sa pagbibigay po nito for probiotics. And then, ano na lang natin for patients kasi na kung all natural din siya, you can also give kefir. Some dogs benefits from that. Pwede rin, ang ano rin natin is fruits and veggies. All natural, actually nanggagaling sa kanila yung prebiotics. Then supplement them with probiotics. The probiotics most likely, which is tong available usually
We
si
have
Promax.
this, yung mga Promax, and also, usually we use Promax for, yung mga sudden na diarrhea for short-term need for an increase in the good bacteria in the gut.
Yeah.
But I think there will be a new product coming into the market. I think it is, it's called Sustain. So, it will be, you can use it as a regular basis to keep your pets gut healthy. Yeah. So, yeah.
Okay.
Yeah. Okay. So thank you so much. If you have more questions, just leave them in the comments and we can get to them later at the end of this episode. And then we are on to the next topic. Okay, our next topic will be physical and mental exercises. So stay tuned. Okay, so we are on to our Is this the third segment of the day? So we have here again Doc Ali for our next topic. This is physical and mental exercise. So maintaining physical and mental activities for your senior pets is very important. So it keeps their mind active and still learning, and they can still enjoy playing around and spending time with you as pet owners. So Doc Ali, take the floor.
Hello. Okay, so our next topic is regarding physical and mental exercises for our senior pets. So going tayo for dogs and cats. Regarding for these types of activities, meron tayong tinatawag na mental stimulation. Kadalasan these are the games. Ito yung mga nag-hide and seek na mga treats in between dun sa ating mga mabibili mga lalagyan. I think we can show that on the screen. So, it's either can be done as DIY, do-it-yourself na mga mental stimulation na toys or for your pets, as well as training, yun yung isa natin pwedeng gawin. So, like here sa example natin sa screen, it's a DIY food puzzle toys for dogs. What they used is actually a muffin tin, tapos nakalagay dyan, nakahide yung mga treats. So, pwede rin gumamit ng, I believe this is our tennis balls, na pwedeng i-hide, tapos kukunin ng dog, tapos tatanggalin, tapos sa kanya makukuha yung treats niya. So, something, reward yung system natin dun sa paggagawa nito. So, kailangan nilang maghanap, mag-scavenge in order to get yung reward na yon. Egg crates can also be used. What else? I think yung isa din dyan, pakita natin po yung nasa bote. Ayan. So, ang gagawin ng dog dyan is itatopple over niya or ipupush niya yung mga bottle and malalaglag yung mga dog food or treats na nasa loob. So, it's a way na parang kailangan niyang mag-isip paano niya makukuha yung food inside. So, ang ano natin dyan is mental games, training, like sit. Kailangan yung turuan sila like sit, stand, roll over, ganyan, come here, ganun yung pwede nyong gawin for your dogs. Although training can be a bit tough, sabi nga nila, senior dogs ba, kaya pa po ba nilang matuto? I think kaya pa naman, tsatsagain nyo lang. Oo, ayun. So, what else? You can also use this, leaky mats. Hindi namin sila ka-sponsor, pero yun, ito yung nakita ko sa internet, leaky mats. So, I think, yan, may mga shops dyan sa Shopee. Sorry, nag-ano tayo kay Shopee. Pero yun, so yun yung pwede natin bilan. So, yan, masaya siyang gamitin. You can use yung mga unsweetened peanut butter, pero in moderation lang.
Yeah, and if your dog is not allergic to peanuts.
Yeah, oo, ayun. Saka wala tayong mga problems sa stones. So, yan, or other types na lang, like food or treats, mga fruits and veggies, pwede naman dyan. Ayun. So, ano natin kasi is, after mental stimulation, pwede rin naman nating i-offer, those are dogs kasi yung mga pinakita ko. What about cats? So, sa cats naman, mental stimulation, kadalasan din is yung, pwede rin kayo mag-hide and seek. I think may nabibili rin sa cats yung parang hole, tapos may parang gumagalaw na mga toys sa loob na rats, ganyan. And hiding treats as well. So, almost the same. For naman tayo, physical exercises naman, what we can do or offer for our senior dogs and cats, syempre, kailangan slow lang or hindi na ganon ka-strenuous yung exercises. So, what are those? Usually, you can do is slow walks, mga 5 to 10 minutes, around the block, ganyan lang. Especially, wag pong sa maiinit na lugar or maiinit na pavements. Ayaw natin magka-heat
Also
stroke.
choose the time of the day.
Oo,
Kung kailan
consider
sila,
na yun.
oo.
So, usually noon, mga late afternoon, mga 4 to 6 o'clock, pwede kayo magpalakad or gabi na. Tapos, use body harness. Yun, laging body harness yung gamitin nyo for your dogs. And for cats naman, accessible lang kasi dapat talaga din yung mga areas na pupuntahan nila. They can still try to jump in high places. Pero ang dyan is kailangan pa rin ma-monitor kung wala bang back problems or hip problems din sila. Pero it's a bit rare, no, Doc Nikki, kapag ka sa cats nagkakaroon ng back or hip problems. Minsan, it's very
yeah,
rare in
or
our practice.
minsan underdiagnosed din
Oo.
because, cats are very, magaling magtago ng mga sakit nila. So,
Oo,
it's
yun.
very important talaga na nakikita rin sila palagi ng mga vets nila.
So, ang ano pa natin pwedeng i-offer is swimming. Pero make sure
Yes.
lang na sila ay matutuyo afterwards. Also provide CrossFit exercises. So, usually doing this is like parang sa tao, you can do squats para for your dogs as well as push-ups and parang drops siya. So, dun sa squats, yung pwede nyo gawin, reward system siya ulit for your dog. Itatry nyo siyang i-train na mag-sit down and then stand up. So, paulit-ulit siya. Repetitive siya for, sabihin natin, 15 reps. Ganon siya sa dogs nyo. Other naman na pwedeng gawin is yung push-ups, lie down, tapos stand up. Yun yung gagawin niya. Yun. So, yun nagpa-flash sa screen, yun usually yung walking, slow walk sa kanila, swimming, as well as fetch. Pwede nyo gawin yung fetch. As long as wala silang back problems or hip problems, pwede nyo pa rin paggawayan sa senior dogs nyo. Kasi we encourage na there's still mobility, there's still mental stimulation for your old dogs. Kasi dyan pumapasok yung nangyayaring, itatakal din natin later, is yung canine cognitive disorder. So, katulad, ito, like Vet Plus, they actually carry this wonderful product, Activate. So, wherein it helps to at least remove the free radicals sa brain nila and maging mas brighter yung itsura ng dogs natin and mas maging parang a bit like puppy-ish pa din yung feeling pa rin nila. So, hindi na yung lumalabas yung symptoms ng circling, baka malesen, pero it can help. Yun lang naman siya. So, nutritional support siya. So, yun. So, just make sure, ang advice ko lang for your senior pets is make sure na accessible everything for them kasi matanda na nga. So, water, food, non-slip na mga surfaces, yan yung maganda yung offer sa kanila, body harnesses, and alalay lang. Kasi we all know na sometimes hindi na sila as likse as before. Ayun. So, yun lang. So, for cats, usually you can still offer towers, accessible litter boxes. Yun yung mga importante din dyan. Na para hindi sila maging soiled, especially yun yung mga pagmatatanda na medyo tamad na. Ayan. Tapos, usually if in case magkaroon ng arthritis nga pala yung mga dogs and cats natin, ayun, then we can also give supplements like Cyanoquin. Ayan. So, which is, they have this special din kasi na anti-inflammatory. So, yun yung mga pwede natin gawin to make it comfortable for your senior pets. Yun lang.
Okay. So, thank you so much, Doc Ali. We have time for questions. 3 questions. Okay.
Doc Dexter ko.
So, this is, okay. So, from Blast Tombok, since cataracts are inevitable, is it still practical to use anti-cataract eye drops on our senior dogs? Or should we just keep it and allot our budget on other medicines?
Okay, sige. Well, the anti-cataract medications are given just to help stop yung pagkakaroon ng progression pa into a mature cataract. Unless na doon na siya sa mature, very opaque, blind na yung dog nyo, I don't think there's more to it na bigyan siya ng eye drops. Kadalasan kasi surgery na siya. So, for me, if in case na doon na siya sa point na yun, wala na rin magagawa na yung medication. Pero if in case na sa immature pa lang siya, we can still give it para lang hindi siya maging malabo pa yung vision. Oo. Yun lang.
Okay, so next question. From Air Forbes or Reliana. Sorry. Hello, how to assess if our dog has arthritis? Any symptoms to watch out for?
Okay. Sige. Later, di-discussion ni Doc Nikki. Oo. Ay! Discussion ni Doc Nikki, pero yun, mas maganda kasi in-depth yung sa side niya. Pero usually, number 1 is pain. Show siya ng pain, limping, yan. Masakit talaga siya. Ayan.
Okay, next question. Okay, from Isaac Kim. Is it safe to make my senior cat undergo an oral prophylaxis?
Okay, sige, good question po. Regarding this, I always recommend the owners na they have to visit the vet. Kailangan silang i-check if apparently healthy sila on physical exam. Plus, we recommend a complete blood work, CBC and blood chem. Tapos clear sila lahat, then ang ano natin is pwede naman sila mag-undergo ng oral prophylaxis, especially if needed siya, like kung nagkaka-severe gingivitis, ayan, mga ano na, meron na ring mga cavities, yan, recommended talaga for the, at least kasi comfort yung ano natin for your pets kasi ang goal natin for the oral prophylaxis.
Yeah. So usually naman 'di ba parang ano mas mataas yung benefits that they get from it compared dun sa risks. So we can assess syempre kung talagang risky ba enough yung surgery or mas magbe-benefit sila with it. So yun, of course, the only right person who can determine that for you is your trusted VIP veterinarian. So it's very important that we have them like overall checkups, ganyan. So bago natin i-subject sila to it because of course they undergo general anesthesia, which is risky of course, especially with senior cats and dogs. But there are also a lot of diseases that they can get from problematic teeth or mouth. Okay, so okay, thank you so much. So I think shout out to Doc Camille from Mr. Alfie Tamesis. Hi, Doc Camille daw. Miss you daw.
Hi.
Yee!
Hi, Doc.
Okay.
Hi, Doc. Hi, Doc Alfie.
Okay. Hi, Doc Alfie. Okay. So, I think we're good. Yeah, you can just comment down again your questions and then we'll get back to them later. But, we are on to our fourth segment for tonight, which is creating a comfortable environment for your senior pets. Okay, welcome back. So we have our fourth segment. This is creating a comfortable environment with Dr. Camille. So so yun, it's very important for our senior pets to be comfortable in their own home. So whether you live in a condo or in a house, so it's important for us to provide them with a comfortable place to rest and eat and play. So Doc Camille will help us through it. Go, Doc Camille!
Ayan, good evening ulit. So, ayan, discuss ko lang yung mga need natin i-prepare at home, lalo na kung may mga kasama tayo sa bahay or alaga na senior dogs and cats. So, ang setup sa bahay dapat well ventilated yung room na pinagsastayan nila. Tapos palagi silang may access to water all the time. Aside from that, yung mga dogs and cats na may problem on their bones, yung mobility nila, yung nahihirapan silang yumuko, need nyong mag-prepare ng elevated food bowl para hindi sila mahirapan uminom ng water and mag-pick up ng food. Aside from that, kung masyadong slippery yung flooring sa bahay, so pwede tayong mag-set up ng mga rug or rubber mat para hindi sila, or anti-slip mat, para hindi sila madulas. So, and then, yung mga, kailangan din silang maging free from small sharp objects at home na pwede nilang maapakan or makain, pati yung mga, kable or mga hagdanan, lalo na yung mga dogs and cats na mahina na yung kanilang vision. So, lagyan ng harang yung mga areas na yun. Bukod din doon, lalo na malapit na mag-summer, so mainit na yung panahon, kung alam nating mainit sa room, better na mag-set up ng cooling mat. So, meron yan available online na pwedeng i-prepare at home para may paghihigaan sila.
Yeah.
Yun. And then, yung lang natin is kailangan well-regulated yung temperature at home. Hindi sobrang lamig, hindi sobrang lamig. Kasi nagiging prone din sila to other respiratory problem naman din. Ayun. So, more of ganun siya yung ginagawa at home. And then, ang lang is kailangan palagi natin silang nakikita all the time, lalo na yung mga dogs, yung mga alaga natin na nagiging mahina na yung pandinig. So, syempre, hindi nyo sila masasabihan, masisita ng tinatawag yung pangalan nila dahil nga mahina yung pandinig nila. So, para makontrol din natin kung saan sila pupunta.
Plus, pagiging blind. Yeah, nangyayari na rin sa kanila.
Oo. So, yun. Also, just to add up, pwede rin kasi natin to make na more accessible yung mga places where they eat, where they drink, para hindi na sila masyadong mag-exert ng extra effort to reach their basic needs. Also, for cats naman, pwede natin dagdagan yung number ng litter boxes or near their favorite place or kung saan sila mas laging nagsistay, para hindi na ganun kalayo yung lalakarin nila for them to be able to exert their self. Kasi minsan nga, minsan parang they get accidents pagka medyo malayo na yung litter box kasi bumababa na rin yung control nila with their urges like to pee and poop. So, yun yung mga pwede natin gawin to help them out. So, yun. Okay? So,
may additional lang din ako.
Okay.
Kung halimbawa may plan tayong mag-set up, ayusin yung mga furniture at home, dapat gradually para hindi sila mabigla kasi mas familiar sila dun sa surroundings na yon, lalo na yung mga mahina yung vision.
like dogs with cataracts, ganyan.
Oo. So, kailangan lang tayo yung adjust din sa kanila.
Yeah. So, ayun. Yun nga. Kasi parang, especially yung mga dogs na doon na sila tumanda sa bahay or cats na doon na tumanda sa bahay, they're very familiar na kung saan nakalagay yung mga furnitures, ganyan. So, kung mawalan man sila ng vision or lumabo yung vision nila, they know their way around the area, that is the space. So, if you move them, parang bigla silang maninibago or pwedeng mauntog, ganyan. Kasi hindi nila alam na nagkaroon pala ng changes doon, especially if mahina na talaga yung vision nila. Yeah. So, it's also, you can also invest in like pet cameras, ganyan, na if you're not at home, you can monitor them para kung meron man mga unwanted emergencies that would arise, pwede nyong makita from on the comfort of your workplace, ganyan. So, yun. Okay, so we have, so thank you, Doc Camille, for your insightful discussion, and we are opening the floor for questions. Okay. So shout out to those that are still watching and still with us. Thank you so much for sticking out. And then again, you can just comment down below so that you can be one of our lucky winners to win a special token from Agfield International. Okay. Our sponsor and partner for today's webinar. Okay, so first question is from Beatrice Miranda. Senior dog goes on a regular walk. Is exploring a new route considered... Senior dog goes on regular walks. Is exploring a new route considered a mental exercise? Thank you.
Yes, exploring a new route, considered mental exercise to, exercise yung brain, lalo na kung hindi siya familiar dun sa surroundings. Ayun, so, makakatulong siya on their, on mental health.
Usually, more of sa parang mental stimulation sa smell. Diba ang dogs kasi they use their sense of smell for parang i-recognize yung kung ano man yung naamoy nila. So, it's good na you can try to do certain routes lang out of your way. Pero syempre yung dapat safe pa rin for your dogs. So, mental stimulation pa rin siya. Okay pa din.
Okay. So, next question. From Razal Ann, how often does a senior dog need to be checked up for CBC, biochem, kidney? Every 3 months or mas okay po once a month?
Usually for senior dogs, it's advisable na magkaroon ng mga check-ups regularly, at least once or twice a year, depending on assessment. Kung may nakitang significant dun sa results from the previous check-up, baka mas frequent. Baka mas kailangan ng every 4 months depending on assessment nung sa veterinarians nila.
So, ko na lang din sa veterinary practice, meron tayo tinatawag na PWP or Pet Wellness Plan. So, you can try to avail it din po. Especially, we have plans for puppies, yung mature dogs, and senior dogs din po.
Yes. So there, dun nga, yun sa Pet Wellness Plan, you can easily just avail it and then we will be doing it for you. Yung mga test na it's tailor-made kasi talaga depending on the age of your pets. So depende kung ano yung mga inclusions dun sa plan is kung ano yung mas kailangan i-check for their certain age group. So for example, for senior dogs, may mga hormonal panels, CBC, biochemistries, ganyan. So yun. It's a once a year checkup, but yun nga, again, as Doc Camille mentioned, depende kasi yung kung gaano kadalas dapat i-check if kung meron nang nakita. So for example, if we're already treating for liver and kidney disease, ganyan, so for the meantime, it will be like pwedeng maging as soon as every 2 weeks pa nga eh. So yun, it will really depend on the findings that we have. Kaya importante na may palaging initial na at least biannual or annual checkups. Okay, last question from Sari San Pablo. Which branches has ECG or ultrasound? Okay, so yeah. So we have ECG and ultrasound on all 7 branches. But I think if you're like specific for heart ultrasound,
sa ano na lang, sa main
just you can just visit the main hospitals like Mandaluyong, VIP, Fort, and Vets in Practice, Quezon City. Okay. So, yeah. You can schedule it and call up your preferred branch so that you can, we can just help you out kung ano yung mga mas prefer nyo na schedule, kung ano yung availability ng mga doctors who can perform this tests for you. Okay? So, thank you so much for those questions and thank you, Doc Camille, for your discussion. And then we are on to our last segment for tonight, and that will be me. It's me, hi!
It's me!
Okay, we weren't warned. Okay, so I will be introducing myself. So tonight I will not be your host only. So I will also be discussing with you the common health issues and preventive care. So Yun. So I have prepared a presentation for you guys so that you can help I can help you understand better yung mga common health issues and preventive care for our senior pets. Okay? So we will be dividing this per system so para mas madali and mas madali natin maintindihan. So first is the digestive system. So ano nga ba yung digestive system? So ito yung mga stomach, intestines, ganyan. So we have I think two common diseases. So the first one is inflammatory bowel disease. So, ang inflammatory bowel disease, this is yung mga certain dogs and cats, they are very sensitive to mga certain types of foods or anything that is new to them. They get upset stomach, or the usual symptoms are vomiting, diarrhea or constipation, straining to defecate, so loss of appetite, bloating, and abdominal discomfort. So, yun. Itong mga symptoms na to, parang very common siya. So, syempre, di ba, minsan yung vomiting and diarrhea could also be another symptom for another disease. So, it's very important for us na mapa-check agad sila sa mga vets in practice veterinarians para makita agad natin if it's really like IBD ba talaga or inflammatory bowel disease or ibang sakit siya talaga. So, yun. So, management of IBD. So, once your dog or cat is diagnosed with this, your veterinarian will be coming up with a treatment plan or management. So, inflammatory bowel disease, it cannot be cured. So, hindi na siya nawawala usually, but it can be managed or it can be treated. So, ang usual is correction of diet. Of course, we have to identify kung ano yung mga diets na comfortable sila or nadadigest nila properly. And of course, medications, kung kailangan ba nila ng mga support sa gut health nila, ganyan. Regular deworming, of course, because sometimes hindi lang basta-basta nagkakaroon ng irritable bowel disease. It could also be because of parasitic infections, ganyan, or viral diseases. And improvement of gut health, that means lang naman kailangan mag-support, of course, ng mga good bacteria like probiotics. So, again, we have supplements available for you guys. So, Promax and the new product, which is Sustain. So, yung Promax, it's usually being given as support dun sa mga, yung mga acute na mga diarrheas. So, it's parang yung study-based talaga kung paano sila nag-come up with the formula for this. So, it's really very effective sa mga dogs and cats na may acute diarrhea. And Sustain naman, ito yung ginagamit for chronic na talaga. Ibig sabihin yung long-term treatment na or long-term na need nila ng extra kick of good bacterial source. Okay? So, yun. For the next one is pancreatitis. So, pancreatitis, it's very, okay, yung pancreatitis, medyo talaga to, medyo diverse yung symptoms niya. So, it's not really easily diagnosed. So, yung first na symptom is vomiting, diarrhea, abdominal discomfort, and loss of appetite. And sometimes, yung dogs or cats with pancreatitis, you can see them parang they go into praying position. So, that's usually a sign na they're in pain. So, the praying position is parang naka-down yung head nila, and then yung butt area nila is naka-lift up. So, yun, parang silang naka-bow and praying. So, that means they're very in pain dun sa kanilang abdominal area. Okay, so, how do we diagnose pancreatitis? Of course, you should bring your dogs or cats in the vet so we can run some blood tests, ganyan, para we can determine if the pain is coming from like an inflamed pancreas. Okay, so yung management natin for this is usually fluid therapy and analgesics to manage the pain. And sometimes yun nga, parang tinatry na slowly binibigyan sila ng mga mas easily digestible na food para hindi masyadong mag-exert ng extra effort for digestion yung katawan nila and to help out with the pain. So next is exocrine pancreatic insufficiency. So, exocrine pancreatic insufficiency, it is medyo complicated siya kasi it usually arises from a chronic pancreatitis. So, ibig sabihin, pag palaging nagkakaroon sila ng problem with the pancreas or palaging namamagay yung pancreas and sometimes it is left undiagnosed, nagkakaroon sila ng exocrine pancreatic insufficiency. So, yung exocrine part ng pancreas, hindi siya hindi siya nagpo-produce ng digestive enzymes enough for them to digest carbohydrates, fats, ganyan. So, yung exocrine part ng pancreas, yun yung responsible for digestion ng mga carbohydrates, fats, and proteins na kinakain ng mga dogs and cats natin. So, pag hindi enough yung production ng mga, ng mga hormones na yun, hindi nila madadigest properly. So, the symptoms is, nagkakaroon sila ng chronic diarrhea. So, yung makikita natin sa kanilang poop, pwedeng soft, bulky, and parang may mga fats or dun sa kanilang pupu. So, yellowish or light-colored feces, occasional vomiting, and excessive appetite. Parang hindi sila masyadong nabubusog, palaging gutom. Kasi nga hindi nila nadadigest properly yung kanilang mga kinakain. And nagkakaroon sila ng gradual weight loss. Nagsiselfie na sila sa topic ko. Okay, so the management for EPI, we call it EPI or exocrine pancreatic insufficiency. We usually shift we advise our clients or our pet owners to shift their diet to highly digestible, low-fat food para hindi na masyadong mag-exert ng effort yung pancreas ng dogs natin para ma-digest yung mga pagkain na binibigay natin. So, it's also beneficial to supplement vitamin B12 and nutritional supplements with additional pancreatic enzymes. So we also have this in our with all our VIP branches, which is the Lipex. So it's a nutritional support that includes pancreatic enzymes to help out with the digestion and to help those with EPI or exocrine pancreatic insufficiency. Okay, so you can just ask your doctors about it, and yun nga, of course, it's maganda na mabantayan nyo lang yung mga symptoms, and then if you see something wrong, you just contact us or let us know para we can help you out.
Yes.
So next system is musculoskeletal system. So usually these are the muscles, the bones, ganyan. So one of our very common diseases that we encounter in our practice is osteoarthritis. Okay. So, osteoarthritis is, nangyayari lang dito. It's also common with older people. So, yung nagkakaroon ng inflammation sa mga joints nila. With dogs and cats, medyo mahirap siya i-diagnose palagi kasi there are other reasons kung bakit sila nagkakaroon ng mga ganitong symptoms. But, it is beneficial na mapacheck sila. So, symptoms is lameness or limping, difficulty with stairs. So, some dogs parang dati and mabilis umakyat ng hagdanan, ganyan, pero bigla na lang parang iiyak pag makakita ng stairs or magwi-whimper when they try to go up, lalo na kunyari akyat na kayo in your house, tapos matutulog na and then they stay down, tapos iiyak sila because they cannot go up. So that's usually a sign of possible osteoarthritis. And then reluctance to stand. So minsan pag they sleep, di ba kasi most senior dogs and cats, mas mataas na yung time na natutulog sila more than they play. So, pag masyadong matagal na nakahiga or if they are on a certain position for a long time, nahihirapan na silang tumayo. So, kasi nga, parang nagkakaroon na ng pain sa joints nila. And then, nagkakaroon ng increased irritability, yung mga sudden aggression. You can also observe that with dogs, dun sa mga dogs and cats na may osteoarthritis because they are in pain. So, next is yung nagli-leak sila ng joints nila. So, sometimes when you see parang palagi nilang dinidilaan yung rump area nila, yung hip area, or minsan yung mga dito sa may paw area nila. So, yun. Kasi they are in pain. So, parang tinatry nila na, kumbaga parang i-massage yung area.
Minsan parang nakakalbo nga yung area.
Yeah, oo. Yung parang nag-over-grooming
Oo.
sila. Especially with cats, it's very common. You can see the symptoms, yung over-grooming sa cats. So, here I have an x-ray of, yung letter A, exhibit A is a normal hip ng dog. I think this is a dog, yeah. So, yan yung normal. So, hindi siya, walang mga protrusions, walang excess na bone growth, and yung protection ng kanilang buto, which is yung mga cartilage and synovial fluid, yung nagkikip ng mga joints natin na fluid, yung synovial fluid. Yun. So, dun sa letter B naman, you can see there, yung naka-arrow, yun yung mga, yung bony protrusion. If you can see the head of yung femur is the long bone, sa leg bone. Yung head nun, it's very, parang nagkakaroon na ng changes dun sa structure niya and mas lumalaki siya. So, it no longer fits dun sa parang curve ng hip. Kaya nangyayari, kaya siya painful kasi nagkakaroon na ng friction yung bone-to-bone friction, it's very painful. Kaya parang nagkakaroon na lang sila ng position na they're comfortable and not in pain. Kasi minsan, pag hindi magkadikit, they're okay, pero biglang nagkakaroon ng rubbing or friction dun sa buto, edi sobrang sakit. Okay? So, management for osteoarthritis, okay, so lifestyle changes, of course, kailangan natin sila tulungan with yung changes sa lifestyle nila. Shorter walks, ganyan, easier na mga, yung mga, kailangan mas madali nilang maabot yung mga daily needs nila like water and food. You can also provide, yun nga, anti-slip mats dun sa area nila. Tapos siguro kung medyo madulas yung surfaces at home, just help them out. Siguro pwede rin sila bigyan ng mga socks na may anti-slip na mga nakadikit.
Ramps din.
Yeah,
Or
yung
stairs
mga ramp sa
pang-go.
beds, ganyan. Minsan dahil nga nahihirapan na silang umakyat sa bed, di na sila nakakatalon like before, pwede tayo mag-provide ng mga ramp or mga maliliit na stairs for them. And then, pain management, of course, there are a lot of options for pain management. So, meron na mga bagong gamot sa market and we can also discuss that with you. Siyempre, hindi lagi din naman maganda na palagi silang binibigyan ng mga pain medications because it could also be detrimental sa mga health ng internal organs nila. So, there are a lot of ways we can help them out with the pain. Physical rehabilitation, Dr. Ali is practicing that as well. So, you can try to consult her with pain management through physical rehabilitation. And then, joint support, supplements, or PRP. So, we have Sinoqueen at all VIP branches. So, yan, it could help with the fluidity of the joints and help with the inflammation of the joints as well. So, next is surgery. So, surgery naman, it's very, hindi siya laging ginagawa, of course, with arthritis. It's just that it's an available option for those na anatomical yung problem kaya nagkaka-arthritis. Especially those yung mga hip dysplasia or hip dislocation. So, ganun. So, kailangan ng orthopedic surgery. And of course, syempre, yung makakapag-recommend lang naman is your VIP veterinarian. Okay?
Ano ka lang din sa, usually for pain, usually laser therapy can also be done. So, which is in our branches sa QC, so the Fort, plus in Mandaluyong, we do that as well. So, if interested po sila, you can stop by for a consult po.
Yan. Okay. So, next naman is our cardiovascular system. So, I will try my best to help you out with this because this is not my favorite topic of all. But yeah, I will try. So, the first one is myxomatous mitral valve disease, or it's usually known as mitral valve disease. So, it's the most common form of valvular disease. So, it's just basically nagkakaroon lang na problem dun sa valves nila sa heart, which is the mitral valve. Nagkakause ng increase in blood flow regurgitation frequency. Okay, so I need my notes for this. Okay. So, yung mitral valve disease, nagkakaroon ng thickening ng valve nila. So, since nagkakaroon ng abnormal structure, para siyang door, di ba minsan pag mainit or malamig yung mga wooden doors natin, kumakapal siya. So, pag nangyayari yun, nahihirapan siyang magbukas. So, nahihirapan tayo pumasok at lumabas. So, ganun din yung nangyayari sa puso. So, if yung mga mitral valve natin or yung valves ng puso ng dogs and cats natin, pag kumakapal siya, nahihirapan lang din yung blood na mag-flow. So, ibig sabihin nagkakaroon ng turbulence or nagkakaroon ng change dun sa usual na blood flow. Okay? So, for the management of this, hindi talaga din nga siya 100% na ito yung gamot pag na-diagnose siya ng ganito. So, it's always very different for each and every dog or cat. So, mas maganda talaga na to consult your trusted heart doctor for this. Meron kami with VIP Manda, VIP Fort, and VIP QC. May mga heart doctors there to help you out with your mga diseases sa heart. Okay?
Yes.
Next naman is next slide. I forgot to discuss the symptoms. So, symptoms of mitral valve disease is excessive coughing,
Yeah.
exercise intolerance, fainting, and difficulty in breathing. Okay? Okay, the next one we have is dilated cardiomyopathy or DCM. So, this is progressive loss of myocyte number and or function. So, myocyte these are the cells na nasa heart natin. So, minsan nababawasan yung number nila or yung viability, ibig sabihin yung effectivity nila to function. nangyayari pag nababawasan yun, nababawasan din yung heart, yung contractility ng heart. So, nahihirapan siyang mag-contract, na mag-pump. So, pag nangyayari yun, of course, nagkakaroon din ng difference or turbulence dun sa blood flow natin, ng dogs natin and cats. So, pag hindi nagko-contract properly, na alter yung blood flow, bumababa yung cardiac output. So, pag bumaba yung cardiac output, di rin nagsisirculate na maayos yung oxygen. So, they faint. Okay? So, yung symptoms natin for DCM or dilated cardiomyopathy, nagkakaroon din sila ng excessive coughing, panting, kasi nga konti yung oxygen, and then nagpe-faint, or what we usually call it syncope. Okay? So, again, with management of cardiac diseases, it's really not hindi siya talaga one-time thing. Walang perfect formula for this. So, kailangan talaga natin ipa-check up sila with this. Especially those senior dogs and cats. It's very common for smaller dogs and cats na nagkakaroon ng mga ganitong diseases. Okay?
Okay. In short, no, Doc, parang yung dilated cardiomyopathy, parang sobrang laki ng puso niya, di ba? Oo, yun. So, kaya nangyayari sumisikip yung dibdib, kaya nauubo sila.
Maybe we can, for our next episodes, we can like delve into this more. Because, yeah, medyo mas maganda rin siya pag-usapan, of course, with our experts talaga with this, ano. Yeah. So, our fourth system is genitourinary system. So, this is just yung ating urinary tract ng dogs and cats and yung mga genital area nila. Okay? So, the first one is urinary tract infection. For dogs and cats, this usually happens, and then for cats alone is the feline lower urinary tract disease or FLUTD, more commonly known as black bladder. So, yun. It is not actually parang focus lang on senior dogs. It can also happen to younger dogs. Younger dogs or cats. Pero, syempre, kasama rin siya kasi some seniors na mga pets, mas nangyayari ito ng mas madalas kasi nga, since mas mababa na yung mobility nila, they tend to keep hindi na sila palaging umiihi kasi they have less energy to perform that. So, lalo na yung mga dogs or cats na sanay lang talaga, or especially with dogs na sanay lang umiihi sa labas or outside sa grasses, ganyan, or they have a preferred place to void their urine. So, pagka medyo tumatanda na sila, lalo na kung may osteoarthritis na, masakit na tumayo and maglakad, mas nagkakaroon na mas nagiging prone sila sa urinary tract infection. So, yun. Yung symptoms naman nito is difficulty in urination. For cats, frequent visits in the litter box. Dribbling urine, ibig sabihin parang hindi steady yung stream when you see them like peeing. Parang nagda-drop lang siya, pero parang hindi normal yung amount. Tapos, sometimes nag-change din yung consistency ng nila. Minsan parang sobrang lapot, nag-change yung color, minsan brownish, minsan reddish, or medyo concentrated na yung wiwi nila. Minsan naman, when we try to clean it up, parang may mga sand contents na. So, you need to parang talagang bantayan pagka ganun yung mga wiwi nila. Tapos, minsan, they leak their genital area. Parang, kasi they are in pain when they urinate. So, tinatry nila dilaan yung area na yon. And then, anuria, meaning absence of urine talaga. So, if your dog or cat, pag hindi sila naka-urinate for more than 12 hours na, it's already an emergency. So, you can bring them in as soon as possible na para maagapan natin. Okay. So, management, of course, meron talagang antibiotic treatments, of course, if there's an evidence of bacterial infection, and if ma-determine na yung kanilang, yung problems with their urination is not behavioral lang. Kasi minsan nangyayari din yung behavioral changes. Like, for example, may inintroduce na bagong dog or may inintroduce na bagong cat. Kumbaga, nag-rebel din, they sold the house everywhere, ganun. So, mas maganda pa rin na mapacheck up para ma-determine natin kung ano yung probable cause. And of course, minsan, pagka may mga antibiotic treatments na hindi na nag-work, your doctors can recommend yung mga urine sample for culture and sensitivity. So, we send it out to a lab, tapos kinukulture siya para ma-identify whatever talaga kung ano yung nagkakos ng infection. And then, we can give the best antibiotic for your cat given that we identified the cause of the UTI. Okay? Supplements to support bladder health. So, these are nutritional supplements which is also available in all our VIP branches. Yung urine aid and cyst aid for cats. So, yun. This could also help with the inflammation, ganyan. ng bladder nila. Tapos, of course, change of diet. If hindi na talaga masyadong pag merong mga ni-recommend yung doctors nyo or VIP doctors na kung ano dapat yung diet na kakainin nila, we should stick to it para mas ma-prevent natin na magkaroon pa ng more complications with regards to the FLUTD or black bladder disease in cats and UTI in dogs and cats also. So, for ang next naman na management, of course, is surgery. Pagka talagang for cats, pag hindi na talaga sila na-address yung black bladder nila, we usually perform urethrostomy. Ayun. So, shout out daw kay Dr. Mao. Pwede daw gamitin yung small breed Sino-Queen for cats. It's from Agfield Technical Support. Which is Dr. George Ibasco. Shout out. Okay. So, yun. For surgical cases of management naman ng UTI and FLUTD in cats, minsan kasi hindi lang naman bacterial infection yung cause. Nagkakaroon din ng baka meron mga urinary stones or cystolytes. Kaya nagkakaroon ng UTI. Parang secondary na lang yung bacterial infection. So, may mga instances na kailangan na talaga silang i-surgery for us to be able to address the root cause of the problem. Okay? Next is reproductive system. So, this is very common naman with older dogs and cats. So, yung mga reproductive system, especially if they're not neutered, yung mga intact pa sila, so they still have their ovaries for female dogs and female cats. And then, yung mga male dogs and cats na may testicles pa. So, we have pyometra. So, everybody's I hope everybody's familiar with pyometra. So, this is an infection of the uterus. For female dogs, female dogs and cats lang naman to. So, nangyayari na nakikitang symptoms usually is distended abdomen, excessive water intake, vaginal discharge, and lethargy. So, vaginal discharge, nakikita lang natin siya for open type pyometra. So, there are two types of pyometra, open and closed. So, pag open type, yun yung makikitaan natin ng vaginal discharge. Ibig sabihin, naka-open yung cervix nila. Kaya yung mga infection na sa loob, nakakalabas siya. Pag closed type naman, yun yung wala talagang discharges pero makikita nyo lumalaki yung tiyan nila and parang masyadong nangihina, hindi nakakain, ganyan. So, it's actually an emergency pag talagang pag closed type siya kasi once nag-over-accumulate na yung mga nana or infection dun sa loob ng mattress nila, it could actually rupture and magkakos siya talaga ng sepsis or yung generalized infection sa buong katawan. Okay? So, of course, management of pyometra, talagang to prevent this from happening, mas better talaga na if you don't have any plans of breeding them, mas maganda na mapaspay na sila as soon as like 6 years old to 1 year old para ma-prevent natin yung mga ganitong klaseng sakit. Syempre, ayun nga, again, prevention is always better than cure. Pyometra is not always complicated, but of course, may mga risk of coming na kasama with the surgery. Okay? So, mas maganda na iwasan na lang natin siya na mangyari. Okay. Next, this is prostatic diseases. This is just solely for male dogs. Okay? So, yung mga... Okay. So, prostate. Yung prostate is just a gland na present sa male dogs responsible in secretion of seminal plasma. So, yun lang naman yung fluid part of their semen. So, nangyayari dito if they're not yet neutered, pag hindi pa nakakapon or intact pa sila, nandun pa yung testicles nila, ang nangyayari, nagkakaroon sila ng prostatitis or namamaga yung prostate nila. Pag namagana yung prostate, there are several factors na pwedeng makakontribute or pwedeng mangyari na doon kasi lumiliit yung daanan nila ng wiwi kasi nag-ano rin yun dumadaan yung daanan ng wiwi nila dun sa prostate. So, pag namaga yun, naiipit yun. So, nahihirapan din sila magwiwi. Okay? And then, pwede rin sila magkaroon ng prostatic abscess. Yung prostatic abscess, we call it parang pyometra naman ng male dogs. Yung nangyayari doon, yung prostate nila, nagkakaroon din ng nana sa loob. So, sometimes, it's difficult to manage kasi minsan, hindi siya nadadala with, not unlike pyometra na pwede mo siyang tanggalin. Ayun. So, yun, pwede mo siyang tanggalin, of course, yung uterus and ovaries ng dogs. But for prostate, it's a complicated process to remove it since nga, yung urethra or yung daanan ng wiwi outside ng dogs is nagtatransect doon yung prostate. So, hindi siya madaling tanggalin. So, yung management talaga doon is to control infection na lang. Ganyan. So, it's not always easy. Kaya, ang pinaka-best bet natin dito is to prevent this from happening. Okay?
Via castration.
Yes,
No,
castrate.
And nagiging prone din sila to urinary tract infection.
Yes, yun. Okay? So, also, another thing is, pwede rin sila magkaroon ng perineal hernia. Pagka namamaga yung prostate nila, nagko-contribute to muscle thinning, lumalabas kung mga ano-anong organs dun sa may butt area nila kasi luminipis yung muscle. Of course, yun, kailangan talaga yun ng surgical intervention na talaga. So, yun nga, we also advocate neutering your pets because neutered is better. Okay. So, ay, meron pala akong okay. So, prostatitis, yung symptoms nito, difficulty in urination and or defecation. Since nga, if you may, discuss ko lang kung nasan yung prostate. Nasa may, malapit siya sa colon. So, pagka lumalaki siya, naiipit niya rin yung colon, napipisat niya. So, nahihirapan din mag-defecate yung mga dogs natin. So, frequent urination kasi nga pwede rin magka-UTI pagka meron prostatitis or nagkakaroon ng inflammation ng prostate, nagkakaroon ng blood in urine, and pain or discomfort in the pelvic area. Usually, nadadiagnose namin yung prostatitis by ultrasound or radiographs or x-rays. Ganyan. Next po. Okay, so yun nga, management natin for this is castration, medications to control further inflammation, and pain management. So, if hindi pa naman well enough yung dogs natin to be castrated, we can give some meds for it to para ma-prevent yung further na paglaki ng prostate. But of course, yung 100% cure or treatment is castration.
Yes. Ay,
Technical difficulty, namatay yung aming laptop.
wala ng battery.
Yeah, okay. So, but the next one is the nervous system. So, nervous system, this is the brain and yung mga nerves ng ating mga dogs and cats. So, yeah. What our first disease is cognitive dysfunction syndrome. So, you have heard this multiple times already with Doc Camille and Doc Ali. So, I will help you guys understand more about this. So, yung cognitive dysfunction syndrome is very similar to human Alzheimer's. So, yung mga dogs natin na tumatanda na talaga, nababawasan yung yung function ng kanilang brain. So, yung symptoms nito, changes in usual activities, nag-house soiling na sila, altered interactions, so yung usual na mga nagre-react sila with you, especially when you get home, bigla na lang hindi na nila ginagawa, or for example, they're very happy to identify yung mga toys nila, tapos ngayon parang they're very confused na kung ano yung mga sorry, may commercial. Okay. So, next is disorientation. Parang, yun nga, katulad ng video na pinlay ni Doc Camille kanina, they're no longer aware of what's happening in their surroundings. And then, nagkakaroon na rin ng sudden aggression. So, yung sudden aggression, parang before, hindi naman sila laging galit or nangangagat. Uy, say hi to the camera! Hi!
Wala.
Ay, hindi sila kita pala. Okay. Anyway, so, yun, yung sudden aggression, yun nga, bigla silang nagagalit, which is hindi naman, if it's not a common thing for them before, yun nga, pwede natin ma-address yun to, like, cognitive dysfunction already. So, next is parang nagkakaroon na sila ng sleep-wake cycle disturbance. Ibig sabihin, parang if it's paggabi, hindi na sila tulog, gising sila pag umaga, minsan nag-howl na sila paggabi, and parang meron talaga silang discomfort na hindi natin maintindihan saan nanggagaling. So, yun. If pagka minsan na-rule out ng all possible options for or all possible reasons ba't nangyayari yung mga ganitong symptoms, usually talagang may possibility na cognitive dysfunction syndrome na siya. Yun nga, minsan din parang nagbabark sila aimlessly, wala naman tinititigan, nakatalikod, nakaharap sa wall, tas kumakahol.
Or
Parang,
pacing,
oo, yung pacing,
back and
balik-balik,
forth,
ganyan. So,
circling.
lakad ng lakad, nagsisircling. So, those are neurologic symptoms already na kailangan natin i-address na talaga. So, yun. Kasi there's walang 100, hindi siya katulad ng kunyari, pyometra, you can diagnose it with ultrasound. Kidney disease, you can diagnose it with blood tests, ganyan. But with cognitive dysfunction syndrome, wala siyang ganong test na, okay, pwedeng i-run to and then we'll know that, na siya, dementic na yung dog. So, it's really symptom-based. Kaya, medyo mahirap talaga siya and it's underdiagnosed nga. Kasi hindi palaging nalalaman na, okay, ito na pala yung problem ng ating mga pets, senior pets. Okay? Okay. So, for management, yun nga, katulad ng mga diniscuss nila, Doc Ali, enrichment activities, pwede natin sila tulungan with this. And of course, parang kailangan, most of the time, they just need to be comforted na talaga. Kasi, yun nga, since they're dementic na hindi na nilalaman ang nangyayari sa paligid nila, so they need to be made aware of what's happening, provide them with familiar options, yung mga favorite blankets nila, mga familiar smells that they're very attracted to, ganyan. So, maintaining a regular routine also. For example, kung kinikip, ano pa rin nyo, pa-walk pa rin sila, ganyan. Or if they can still pee outside or defecate outside, gawin pa rin natin para they can sense some familiarity. Hindi sila masyadong malost. And of course, usually, palagi naman na meron tayong pwedeng i-provide na help sa kanila with nutrition. So, yun nga, nutritional intervention, yung mga diets containing antioxidants and omega-3 fatty acid. So, it's a bit hard for us to determine ano ba talaga yung mga pagkain na may mga ganito, ano ba yung dapat talaga i-provide. So, luckily, we have yung mga ready na sa market to help us with this, which is yun nga, we also have this in all VIP branches, yung Activate. So, it's complete na with all the nutrients and yung mga antioxidants that we may need to provide sa mga dogs natin na may cognitive dysfunction na. Okay? So, this could also help. So, you can take a screenshot of this. So, if you see na may mga symptoms na yung mga dogs natin ng possibility na meron na silang cognitive dysfunction, you can get this questionnaire. This is from VetPlus or Acted International. So, you can answer this if meron na talaga, if siguro if 80% of the questionnaire you answered yes, mataas yung chance na meron na silang cognitive dysfunction or dementia. So, you can present your, pag nakuha nyo na yung questionnaire and then you get to answer this and then you feel like kailangan na talaga silang ma-check, you can bring the questionnaire along with you and visit your Vets in Practice branches para mas matulungan namin kayo. Okay?
Ganda pala yun, no? May ganun na rin questionnaire
so,
provided.
maganda. Kasi, di ba, minsan, hindi rin, yung mga doctors, of course, since nga it's underdiagnosed, medyo mahirap for us, ano ba, i-differentiate kung ano ba talaga yung, kung meron pa bang underlying disease or meron pa bang ibang causes dun sa mga symptoms. So, yun. Kaya, makakatutulong sa both sides, or pet owners and your VIP veterinarians if you can complete the questionnaire. Okay? So, just key takeaways from dun sa pag-care or like to manage your common diseases in senior dogs or senior cats. Always consult your VIP veterinarians regarding your senior pet's health. So, again, prevention is always better than cure kasi nga may mga bagay na mahirap nang gamutin if it's already there. So, most of the time, it's no longer treatable or no longer curable. Management na lang talaga yung nagagawa natin or what we call palliative care. And then, dahil nga medyo short talaga yung buhay ng mga pets natin, always enjoy your time with them, precious time with your pets. So, yun. So, next slide. So, yun lang. So, sometimes we wonder, bakit nga ba yung mga dogs and cats, they live very short. So, yun nga. I just found this quote online. It's from a known source. But, yun nga. People are born so they can learn how to be good people. That means loving others. But pets, they already know how to do that. That's why they do not live as long as we want them to.
Aww.
So, yeah. Oh, wala, huwag kayo umiyak. Yun lang, just for us to be, more comforting words sa mga those na nakakatakot na if they're reaching a certain age na talaga na may mga lumalabas na ng mga symptoms na ayaw natin, ganyan. So, it's very important na, just spend time with them. Yan, wellness checks and as long as we can prevent them, kung hanggat kaya nating pahabain yung buhay nila, just we can do that and we can help you out with this. Okay? So, I think that is the last topic. Yeah, so I hope you learned something from this webinar today.
Yes.
So, So we have questions, and then yeah, we will be back for your to answer your questions. So you can just type in below, and then we can answer all your questions as much as we can.
Yes.
Thank you so much for tuning in. Hope to see you later pa din. Bye!
Ay, we're back na.
Hello! So welcome back. So we have now we're now back together kaming tatlo so we can help answer your questions. And then shout out ko lang pala, we're here at Vets in Practice Pet Clinic. So we are here at VIP Capitolio. So this is the newest branch of Vets in Practice. So we can give them a visit, and we have here Dr. Mao and Dr. Gina to help you out. Yay! Congratulations, VIP. Okay, so first question from Therese Mercado. Is it normal for a senior lab to have fat lumps around her body? Our vet said it's not cancerous, and I am closely observing but thinking of getting a second opinion. It doesn't bother our lab, and she is not in pain when we touch her fat lumps. Okay, do Camille, do you want to answer this question? Tumaas yung camera. Yes, oo. So,
Sorry. Hello. So, regarding dun sa question, yes, it's normal on some senior dogs to have fat lumps, tinatawag na lipoma. Alarming lang siya if it causes pain, dun sa pasyente and lumalaki siya ng sobra na pwedeng maging sagabal during walks or during sleep pag nakahiga sila. So pag ganyan, kailangan is-surgically remove. If not naman, I don't think na concern natin. Pero kung yun nga, worried kayo, magandang ma-check siya personally sa kanilang respective veterinarians or sa near vets in practice na branch. So 7 yung aming branches. So kung saan sila mas malapit, better masilip siya physically.
Yeah, yun. So, just an additional dun sa answer ni Doc Camille. So, minsan kasi, talaga, if mas maganda talagang diagnosis is biopsy, so, surgical biopsy. So, if hindi talaga tayo sure if it's something to be worried about or not, mas maganda to collect a sample, send it out to the lab, ganyan. But, of course, it will be advised naman depending dun sa magiging physical exam natin dun sa dog. Okay? So, next question. From JM Lina. Hi, docs. What diets do you suggest for old dogs? Doc Ali.
So our diets for... Hello? Okay. Sige, so,
Go.
what diets do you suggest for
Hello?
old
Hello?
dogs? If in case kung we're gonna use yung mga... Hello? So, may mga available kasing mga senior diets na commercially available. So, yun nga nabanggit ko kanina, like Royal Canin. You can try yung mature dog nila for senior dogs. Other brands din naman, naki-carry din naman for that. Pero if in case you want something nutritionally balanced pero cooked meals, I suggest that you try to approach or have a consult with your veterinarian as well. So, yun yung natin for older dogs. Yun. Anything that is tailored for senior pets and low yung calories, yun naman usually yung recommended natin para sa kanila.
Next question. No seed Ea. I have been noticing that my 10-year-old and 7-month-old Chihuahua, 10-year and 7-month-old Chihuahua seems like afraid of something, especially at night. Is he suffering from anxiety? Okay, so I can answer this for you. Yeah, I am a Chihuahua mom also. Very proud. Sorry. So, yeah. Siguro, kasi, di ba, especially Chihuahuas, they really, medyo mas anxious talaga sila compared to other pet breeds. So, pwede rin naman na nagkakaroon siya ng anxiety, but it's really, if it's not a common occurrence or parang bagong symptom siya, you can try to answer the questionnaire we presented earlier. Baka kasi meron na rin cognitive dysfunction. Hopefully, hindi naman. And it's just baka lang talaga, meron lang siya naririnig or baka merong mga frequent visitor ng mga birds dun sa area nyo or na hindi palagi nangyayari before. So, ayan, mas maganda pa rin na ma-check siya para sure tayo na it's not something serious or hindi siya cognitive dysfunction. Okay? So, thank you for your question. Next po. From Beatrice Miranda, pa-explain po ng hip dysplasia and how to manage among senior dogs. Okay. Ako again. Okay, so hip dysplasia kasi, kasi siya, minsan it's genetic. So parang kahit na bata pa lang sila, meron na silang hip dysplasia. It just so happen na ang nangyayari sa hip dysplasia, yung connection ng leg nila, which is the femur, yun yung long bone sa leg nila, sa hind leg. Hindi masyadong deep yung attachment dun sa hip. So, we usually call it parang ball and socket. So, pag yung ball, yan. Ito yung socket. This is the socket of the hip and this is the ball of the femur. So, dapat ganyan siya. Or dapat yung half ng head ng femur is connected to the acetabulum or yung parang socket natin. So, if dysplasic siya, hindi siya masyadong naka-attach properly. So, pag hindi siya naka-attach properly, mataas yung chance na nagkakaroon ng friction or nagkakaroon siya ng, minsan pag nagkakaroon ng maling galaw or minsan nga, parang konting nag-slip lang, nadulas, ganyan. Tapos, nag-out na yung buto, nagiging na siya, nagiging dislocation na siya. Okay? So, pag nangyayari yun, pag among senior dogs naman, hip dysplasia, usually ano na rin siya, secondary to osteoarthritis na siya. So, yung management lang naman dito is, yun nga, yung mga nutritional supplements to help with the fluidity of the joint. Yun. We have Cynoquin available in our clinics, ganyan. And then, of course, yung management naman ng pain, we have pain rehabilitations, and then, may mga bagong drugs din sa market na pwede nating i-inject once a month. It's called Librela from Zoetis. Ayan. So, syempre, kailangan natin malaman, pa-check nyo pa rin sa mga dogs and sa mga veterinarians yung dogs nyo para malaman natin kung ano talaga yung mag-fit better dun sa kanyang sakit, kung anong mga medications or supplements that we can provide for them. Okay? Okay, from Nami Blake, do you have wellness packages for senior pet? Doc Camille?
Wellness packages for senior pets. So, mag-a-avail sila at nearest veterinary vets in practice na branch. So, included dun yung sa mga blood chemistry, complete blood count, and yung consult, may mga discount din dun na naka-indicate. So, kung gusto nilang mag-inquire, so visit our nearest vets in practice clinic. So, 7 branches meron tayo.
Okay. So, next question. Okay. So, from Therese Mercado. So, our lab, 7 years old, has been on barf or raw diet since birth. But so far, no problems, and we give her vitamins plus fish oil. Sorry. Is it okay to continue with this diet for her? She also eats raw veggies and fruits. Doc Ali, question for you, I think.
Sige. So, regarding that, if in case yung 7-year-old lab nyo po is, kung doing well naman siya with the barf diet, kasi 7 years old, medyo papunta na rin kasi to senior din for a Labrador. So, recommended din natin eventually, baka we need to change it into a senior diet then eventually. I recommend na lang na at least na ma-check na lang siya with a certified nutritionist na lang, animal nutritionist. So, para at least tailored siya specifically for her pet. Especially kung raw diet na rin kasi yung na-start na rin sa kanya. So, transitioning is kailangan, nutritionist na dapat gumawa po nun. So, meron tayo si Doc Denmark po yung gumagawa nun.
Sa Vets in Practice
sa Vets in
QC.
Practice QC. So, you can still give pa rin
And Fort
naman.
also pala.
And Fort.
Okay. By schedule at VIP Fort and VIP QC.
Yung vitamins and fish oil, it's fine. Wala namang problema to give it to your dog. Tapos, offering also raw veggies and fruits is okay as long as tolerate ng tummy niya. Kasi some dogs have allergies in certain types of fruits or veggies. So, kailangan nyo rin i-monitor din yun.
Okay, thank you for your question and answer, Doc Ali. So, this is from Sarah Garces. Is it still safe for a senior dog, 10 years old plus, to undergo a spay procedure? Okay, ako ba yun? Sige, ako na lang. Okay. Okay, so ayun nga, if the benefits outweigh the risk, of course, pwede pa rin naman siyang gawin. 10-year-old dogs, usually medyo mas prone na sila to getting pyometra as I discussed earlier. So, kung hanggat normal pa siya, if yun nga, mas maganda pa rin syempre na mag-run tayo ng mga pre-operative blood works, yung mga heart tests, ganyan. So, test natin kung okay pa ba yung puso niya, if kaya pa niya i-take in yung sedation, ganun. So, if everything turns out normal, we can do that because spaying naman, medyo straightforward naman yung procedure na yan. So, yun, hanggat kaya pa niya and we prove that everything is okay na mag-proceed dun sa procedure, then we can go ahead with it.
And, ano lang din naman kasi age is not a disease. Yun yung dapat din nating tandaan. Lagi lang kailangan kasing tandaan natin is all okay yung patient before mag-undergo ng procedure. That's like Doc Nikki said na naman.
Okay. Oh, hi Tito Esmer watching from Bohol. Annyeong. Okay, thank you VIP for conducting this webinar. So you're welcome and we hope to see you on all our following episodes soon. So you can just comment down below what topics you want for our next episode. So maybe we can choose from there. So yan. Thank you also for watching and subscribing to us. Oh, vlogger yan.
Next question.
Okay. So, next question from Sarah Garces. How to help a blind senior dog from bumping into walls or furniture? Should they wear something to help lessen the impact?
Okay. I'm not sure kung familiar na yung some people regarding do sa angel halo siya na sinusuot na body harness. So maganda siya for dogs na senior as well as blind dogs. So usually I checked it out. Meron siya online. You can try to check po yung something harness siya or halo wearing po para sa mga blind dogs. So, yun yung isang pwede nyo pong i-try. Pero if in case wala kayong access, most of the time, it's tayo yung kailangan natin na lang i-monitor and i-help na lang yung dogs natin na wag na mag-bump into places. Try to use something, maybe yung mga ginagamit for babies, yung mga safe things.
Baby-proof.
Yeah,
Yeah, baby-proofing,
Ng mga bagay.
Yes. Yan. Okay. So, I had, may na-receive akong message na meron kaming surprise guest. So, we have here, Dr. Mao and Dr. Gina. So, they are our Vets in Practice Capitolio's partners. So, can you give us a few words po? Congratulations po.
Thank you and welcome sa VIP Pet Clinic sa aming new branch, and then we just celebrated our first monthsary bale. And then if you have other concerns and pet concerns, you can visit us all our branches naman. So this one sa Capitolio area lang. So yung mga malalapit dito yung mga condos yun, you can visit us, and then we're open from 10 a.m. to 7 p.m. Okay? Thank you.
Hello. Good evening. Thank you for thank you for doing this Facebook Live sa Capitolio branch. It's our new branch, newest branch ng Vets in Practice. So come visit us. We're here every day. We're open every day. So I'm here every Sunday to Wednesdays. Dr. Mao is here from Thursdays to Saturdays. 10 a.m. to 7 p.m. Thank you.
Oh. Okay. Thank you so much, Dr. Gina and Dr. Mao. So, yan, you can come visit them at Vets in Practice Pet Clinic. So, at VIP Capitolio. So, we're here now. So, yan. Okay? So, we have time for like few more questions. Okay, this is from Abigail Lenore Cataluna. Good PM, doctors. Our 11-year-old fur baby is overweight. Can you suggest ways for us to help him lose weight gradually? Okay. Doc Ali, it's your turn to shine. Ay! Hello?
Ay. So, for your dog, we recommend din kasi na how to gradually lose weight. Number one, is your dog na ba kasi started na ba or prescribed by your vet a senior diet? Yun yung isa yung pwedeng gawin sa kanila to at least do a calorie deficit or not calorie deficit, less calorie dense na diet para sa kanila. Isa pa is your dog sedentary or less active ba siya? Kasi it can contribute kasi dun sa pagkakaroon niya ng heavy weight or overweight kasi siya. So, I suggest that you try to encourage your dog with a healthy lifestyle like slow walks, dun kayo magsimula, or maybe indoor activities lang like yung slow feeding, pwede gumamit ng mga licky mats or yung slow feeder para at least your dog will be controlled yung kain nila. Plus, since kung di rin siya masyado nang gumagalaw or di ganun ka-active, recommended din natin na do not overfeed your dogs. I know na nakaka-tempt na kapag nagbe-beg sila, we have to give treats, table food.
So kawawa.
So kawawa. I know. Chicken. Yan. French fries. Pero wag natin sila bigyan excessively. So, yun lang. Controlled diet lang ang recommended natin for senior dogs and healthy lifestyle.
Yes. Okay. Thank you so much, Doc Ali. So, next question. Ay! Hi. Hi, Doc Bim. Yeah. Hindi ko alam. Bye. Okay. From next question from Steph Ordoveza. What joint supplement do you recommend for senior dogs? Okay. Okay. Doc Camille, go.
recommend, yan, yung Cyanoquin usually yung
Yes.
recommend namin. Yeah. Depending on the size. So,
Ooh, go Agfield!
may ano siya, may variation siya. Meron for small dogs, medium dogs, and large dogs. So, usually, nagsa-start siya with, 6 weeks yung kanyang protocol and then mangyari as maintenance na niya.
Yun. So, yeah. Yun nga. Ang ano naman yun is, kasi since, siya, easily available siya, and palatable din naman siya. So, hindi kayo mahirapan to give it to your dogs. And cats, kasi sabi, pwede yung Cyanoquin for cats, yung small na Cyanoquin.
Maganda sa kanya, meron siyang glucosamine, tapos may chondroitin din that can help sa, may anti-inflammatory properties for the joint.
Baka better, mas masagot na ng tanong natin is Dr. George Basco. Or, the technical officer from Agfield International. Hi, Doc George! Yes! Woo!
So, hi, good evening po sa lahat ng viewers. So, magandang gabi po. So, si Cyanoquin, it has glucosamine and chondroitin combination. So, meron din siyang dexahan which helps with the inflammation. So, definitely hindi kasi natin nare-recommend talaga yung pagbibigay ng NSAIDs or using NSAIDs for long term. So, with Cyanoquin, it really helps na malesen na yung gamit niya ng NSAIDs. So, it is relatively safer to be used long term. So, ayan po. So, it's available with your vet clinics, especially with Vets in Practice. All branches ni Vets in Practice, they carry Cyanoquin po. So, ayan.
Thank you so much, Doc George. So, yun. Yun yung ano natin. Okay? So, we have time for how many more questions? A lot more questions. 3 more? Okay. So, next question from Olivia Tatad. So, can you help my 20-year-old senior dog on the best protein food? Arthritic meds and intestinal management. Sometimes the poop is wet, sometimes with stomach flatulence. Thank you. God bless all of you.
Okay. 20 years old. Wow. Congratulations. Okay. 2 decades with your senior dog. That's really good for you, ma'am. So, for the best protein, actually, mga proteins na available kasi na on hand na kaya natin may access is beef, pork, chicken, and fish. So, if fish, usually ang magandang i-offer is yung salmon, yun yung isa. A bit pricey, pero it's good. Pero, mga white fish din, like tilapia, is also a good alternative din. Pero, ang ano din natin is kung may access din kayo sa rabbit meat, yan, you can try that too. Available, yes, meron din po tayong binibentang rabbit meat, I believe, sa 4th branch. Opo. So, it's a farm naman siya na rabbit meat. Ang ano na lang po natin for arthritic meds niya, we have Cyanoquin, yun yung isa natin na pwede offer for you, as long as it's diagnosed by your veterinarian. Kasi yung importante is the glucosamine chondroitin na inside of that medication. For intestinal management naman, if your dog's having this kinds of problem, prebiotics and probiotics are good for your dog actually. Especially mahina na rin kasi yung intestinal or yung good na bacterial loob ng tiyan ng dogs natin, you can offer those po. Pero I still suggest na your veterinarian should be the one to prescribe it. Oo. Ayan. And ang ano ko lang naman is overall, maganda pa rin ma-check up pa din siya to give you the best treatments and ayun po, for the long run din, especially 20 years old na siya, yun, maganda po ma-check up muna siya ng your doctors.
Yeah, congratulations na 20 years old na yung dog. So, that's very unusual and very good, yeah. Ang galing mag-alaga. So, ayun, just, as much as we, we tell you that the products are good, ganyan, itong mga supplements na to will help out your dog a lot, it's, pa rin, palagi pa rin na, you can also just get this from your vets talaga. So, we don't really recommend self-diagnosing, self-treatment, So, even though these products are safe, syempre, mas maganda pa rin na manggagaling siya sa mga trusted VIP veterinarians natin. Okay? From Ion Pascual, pwede po ba yung senior wellness package even na surgery ng pyometra and hip dysplasia?
Yes, included siya sa package. Usually on surgery, discount yung meron. Pero for hip dysplasia kasi, kailangan natin check into x-ray. So, pag ganun, is may kasama din siyang discount dun sa senior wellness package.
So, ayun nga. Kasama siya na parang covered siya, like the x-ray for diagnosing ng hip dysplasia. Kasi ano pa rin naman medyo kahit na pyometra surgery na siya or na surgery na siya for hip dysplasia, you can still benefit from it for other na mga preventive diagnostics like yung mga blood test, yung mga annual vaccinations and deworming, mga ganyan. So, you can just go ahead and visit us para mas ma-discuss namin better yung package and yung kung ano yung inclusions niya. From Kiara Dizon, hello, for the supplements presented earlier, with prescription po ba dapat ito before giving it to our pet?
Most likely, recommend namin muna, yes, ma-check up muna yung pet before we prescribe it. Kasi some of these are specific for a specific condition talaga. So, yung iba kasi specific for bladder health, or yung sa joints, and yung probiotics. Although, yun nga, sabi nga ni Doc Nikki, these are supplements. Usually, they are not that harmful naman. Pero, maganda pa rin na
Hello? Hello? Okay na. Okay, go. Sorry, I think we lost the audio. Doc Camille Doc Ali can repeat the answer.
what was the question? Yeah, yun. For me, maganda pa rin siya ma-check up ng vet. Kasi some supplements, although as per Doc Nikki said nga, it's not that harmful naman for the body. Pero if hindi naman kasi siya needed, then hindi rin naman magagamit. So, might as well po, ma-check up na lang siya.
So, yun. The supplements are only helpful if we know the diagnosis, of course. So, syempre, parang it's just sayang if hindi naman para sa kanya yun or hindi naman magbe-benefit yung pets natin with it. So, yun nga, the only person qualified enough to tell you that is your VIP veterinarians or any of your trusted veterinarians, of course. And then, all these products are only available on veterinary facilities. Ayun, so, yun, mas maganda if you can get it from a reputable source. Okay, from Anjmil Valenton, please give B2 belly rubs and ear scratches from me. Aww. Thank you. Yeah, so, yan, if you know B2, we posted B2 parang previously. So, that's our hospital cat at VIP Mandaluyong. So, B2 is experiencing liver and kidney issues because of old age. Senior na rin. So, yun. Kaya medyo we're giving B2 extra love and attention now. So, thank you, Pat. Okay, thanks. Next. Okay, yeah, so we have our winners already from our from our comment section. So this is a randomly generated selection. Tama ba? Yeah. So yun. So we will announce the winners, and you can just send us a private message and screenshot of your comment, and then send it over to Vets in Practice Facebook page so that we can tell you how you can claim your prize. So number 1 winner is Sarah Garces. Congratulations! Woo! Okay. Number 2 is Apple Cortez. Congratulations. Number 3 is Coco Gold. Okay. Number 4 is Seria Monica. Yay! And then next is Olivia Tatad. Yeah, so thank you so much everyone for tuning in on our live. So I think that's it. Okay, so yeah, we just have a few final words from our speakers for tonight. But I just want to thank everyone for sticking out until the end of this webinar. And we hope to see you soon also. Stay connected on our socials. You can follow us on Facebook, Instagram, and TikTok. Yeah, YouTube also. So you can follow us from those socials. But you can watch out for any announcements of the next webinar episodes on our Facebook and Instagram pages. So just give us a follow and a like so that you can keep you can be updated with our next episodes. Also, yun, you can just comment kung ano yung mga gusto nyong susunod na topics so that maybe we can choose from there and then help you out with yung mga topics na gusto nyong marinig from us. Okay? So, Doc Ali and Doc Camille?
Thank you for listening, and sana marami kayong natutunan on our webinar for today. Ayan, so
Yun. Yan. So, yeah, Doc Camille, first time kasi niya mag-live on this show. Yeah. So, yan, thank you rin for everyone who's watching. I hope na everything is doing well, especially with your senior dogs. So, next time, we might have another webinar. Ano to? Live webinar, talk show. Ayan, to educate you all owners with all your concerns. Okay.
So, yun, I would just like to thank also my colleagues, Dr. Camille and Dr. Ali, for joining me in tonight. And of course, the people behind the scenes, yun, for our production team, and of course, Agfield International for partnering with us tonight to bring you this webinar for your senior companions. So, yun, we hope you learned a lot from us tonight. And again, we thank you guys for supporting us. And we hope to see you soon. Bye-bye!